everybody. This is Dr. Elsie Coe from Lead Physician, the online program for physician leadership. I'm so happy and grateful to be announcing another physician, a great physician I've been speaking to. You're going to love her. This is Dr. Loren Robinson. Hi, Loren. How are you?
Hi, good to be here.
She's the VP of Medical Affairs at CHRISTUS St. Michael Hospital in Texarkana, Texas. I'm going to get this straight. And she's been doing some amazing things in such a short period of time. I feel like she knows how to make it happen. So I'm really happy to introduce you to her. She's responsible in her organization in terms of the quality and the safety efforts and the recruitment of physicians. So, Loren, I want you to tell your story. There's so much I'm missing here. So tell us how you use your leadership journey, how you made it to where you are right now.
Thank you for asking, Elsie, and thank you so much for having me. I think, if I think back to my time in residency, I think of years I probably could have gotten back in my life if I had a series like this to kind of help guide me. Because when I was coming through residency, there weren't a lot of people who were doing these non-traditional things with medicine. It was all kind of, you go into clinical medicine and that's what you do. And in general, then it was academic medicine or community practice, and that was it. Those were the two pathways, and there was nothing else to think about. And so to know how many physicians are now in leadership and so many different sectors, I think it makes a huge difference in the practice of medicine and in the lives of our patients. So I appreciate this opportunity.
Yeah. So how did you start? Like, how did you even end up there? I know you're not even from Texas.
No, I'm not actually. So originally from just outside of Buffalo, New York, and was in med school in North Carolina, and then at Duke, and then stayed at UNC Chapel Hill. So that was crazy in and of itself with the Duke and UNC rivalry there. But stayed in North Carolina for residency and thought I would actually be in North Carolina for the long term. I really liked what it offered. But as I matriculated through residency, I started thinking a lot about what are these factors that are impacting my patient's life beyond what I'm doing in this quick 15-minute clinic visit. And so started thinking and hearing more about health policy. The Affordable Care Act was passed kind of right as I was going into residency. And I really felt like I didn't know what the Affordable Care Act was. As a resident, I was told, it's just to help you take care of people, and now everybody will have insurance. And it seemed like that was good enough at the time, but as I became a practicing physician, I realized I didn't have a really great grasp on what the Affordable Care Act was or who wrote it, and I wanted to learn more about health policy. So I went to Penn for the Robert Wood Johnson Clinical Scholars Program to learn more about health policy and how physicians can be involved in health policy and what that would mean, what that would look like. And from there, joined the Pennsylvania Department of Health as the Deputy Secretary for Health Promotion and Disease Prevention. Primarily because
was that hard to get that position? I mean, how did you find that position?
At the time I was applying, it's a really interesting story. I applied for a position with the city of Philadelphia, and they said, you don't have really much experience. We see that you've got this degree in policy and you're a physician, but you don't have a lot of experience with government. And so maybe come back to us in a few years. And so a couple of weeks later, I applied for this position at the state. And they took a chance on me. And I was like, wow, how can I get this position at the state when the city thought that I wasn't experienced?
That's amazing. Isn't that funny?
You really, and you just never know until you try. And that's why when I talk to people applying for things, and whether it's a job or an award or a fellowship, I say, put yourself out there. Because you never know what part of your story or your experience is going to resonate with exactly what an employer is looking for. So, I had a passion for health equity. I insisted that the Office of Health Equity be moved into my office at the Department of Health, really to make sure that we integrated our efforts that we were doing across the state of Pennsylvania to ensure that we had health solutions that fit for communities, and to hear from communities about what they wanted to work on from health. So it'd be really interesting we'd get these reports on, this is what health looks like across Pennsylvania, and this community has this big health issue. And then you go and talk to community members, and they would say, well, the thing we're most passionate about that would help us be healthy is this. And so, we would say, let's build gyms, and they would say, we need sidewalks so we can walk with our kids to school or do community exercise. And so it's so interesting to really be able to hear and understand the community. And that's what, health equity is all about.
Love that. Yeah. So then how did you end up in Texas?
So that's, part of a professional journey, obviously, is moving. And so it's a combination of personal and professional. I got married, and we had a baby, and wanted to find opportunities that worked for both of us.
Okay.
I was at a point where I knew that I wanted to continue working outside the home. I knew that I wanted to continue working in healthcare. I really liked health and healthcare leadership. And as I was working at the Department of Health, I worked with different positions, and I realized there's a lot of things in medicine that don't work for doctors. And so as I was looking for a position, I wanted something where I could do something that would improve the health of patients, but also ensure that physicians had a great quality of life and really liked coming to work. You know, as we talk about physician burnout and you think about things like that, I wanted this wherever I was working, whatever I was working on, would be toward creating a place where doctors would want to come to work.
Wow. So how did you even apply? You just asked for that position, and it was just given to you, right, Lauren?
I mean, obviously, like praying every day. I started Googling. I used LinkedIn a little bit. I used Indeed, and I would type, health leadership jobs and health policy jobs just to get an idea. And I did this when I started looking for the job with the state too, to think about what kind of words and actions and what kind of projects would I want to work on.
Yep.
Someday, and then it helps you figure out, like, is this something I want to work on immediately or further on down the line? And this opportunity was just amazing because as my partner was being recruited here, the team that was recruiting him at his clinic really took an interest in knowing that for us both to be happy here, we both needed to have professional opportunities that served our individual needs. And so he told them a little bit what I did. I talked to them about it, and they started talking to community members to say, do you have opportunities in health leadership or healthcare leadership in this community? Because we're trying to bring this couple down here. We want it to work for both of them.
That's very progressive. That is very
progressive. And yes. It was unexpected for a small town. And
I think more people should think about that when they recruit.
Absolutely.
Yep.
That's the best way to recruit.
Yep. So they created this position for you, or it was there?
This position has been here. The Vice President of Medical Affairs has always overseen the quality and safety efforts, and then also has looked at patient outcomes. And so our coders and billers also had reported into the Vice President of Medical Affairs. We are one of the only systems in the CHRISTUS system that has a Chief Medical Officer and a Vice President of Medical Affairs. And I think they're looking to figure out if they need both or if they would combine the role. So it's been interesting. And then COVID hit, and COVID didn't show up and say, this is who should take care of me. And so trying to figure out where in a health system or who should be tasked with managing that. It just so happened with my public health background, it's a natural fit for me.
Yeah, it's so perfect. Oh my God.
It was excellent. And I would say our hospital responded very well to the COVID-19 crisis. And I think it speaks to the resilience of this community and the foresight of our leadership here.
Good job. I mean, what an inspiring story, Lauren. How do people, how do other women, I mean, you're very inspiring. So how would somebody like someone who's a minority, somebody who's in a disadvantaged group, person of color, a woman, how would, what advice would you give them if they wanted to get into leadership? They might be, have a little bit of imposter syndrome. They might not have done it before. What's the first step? What's your advice for them?
I think the first step is and it's challenging, right? Because you're thinking, gosh, I want to be a leader. I want someone to look at me and say, you're a leader, and identify that and come to me and tell me that. But you really have to step out on faith, and you have to ask yourself. You've got to knock on every door. I like LinkedIn because it lets you learn about some people's leadership paths, and you might see someone in a position that you want to be in someday. And so if you can message someone on LinkedIn, you can Google people's names and find almost anyone's email address. Just to email someone and say, hey, do you have a few minutes to talk about your leadership journey? Or, hey, I'm a young woman of color and I'm interested in this. I see that you had this experience. Could you tell me a little bit about that? And even from there, after you had a couple of conversations, the next step is to say, hey, would you mind mentoring me? I'm preparing to take some of these steps that you've identified, but I'd like to have the opportunity to talk with you about this as I'm moving through this journey. I think mentorship is huge. But you're not going to know unless you ask. Sometimes people will ask to mentor you, or people will reach out to you, but you've got to reach up and ask someone for that help and that guidance.
Wow, that's very good. So, where do you see organizations kind of lacking in resources and support for minorities or disadvantaged, populations for leadership?
I think sadly systemic racism has disadvantaged this country. And I say that because I think it's led to a homogeneity in leadership. And so I think you know, when you have a diversity of leadership, it means you have really great ideas coming from everywhere, and it helps your organization grow. Growing can be uncomfortable, and it is difficult, or it might not feel as great as a whole bunch of people who look like you and think like you. But when you have people from different backgrounds and different races or different parts of the country, just different ideas, it helps you approach problems in a more dynamic way, and you're much more likely to come up with a solution that works for a bigger group of people. When that happens, you have, you know, higher employee satisfaction. So I mean, everything just ends up cascading kind of down this very positive hill where, you know, your margins are improving in the hospital because people want to actually come to work. They don't want to, you know, call out. And so I think the best way that we can address this is to acknowledge that it exists. You know, if you look at C-suites across our country, the chief diversity officer role is almost always a woman of color or a person of color or a woman. And obviously women and people of color can do a really great job in that position, but that's not the only thing they can do. And so we really need to think about how do we diversify our leadership structures beyond having a person of color in a diversity role. That means that we need to have people of color and women who are CEOs, CMOs, CFOs, your chief information officer. We need to be looking in these communities that have been historically represented to make sure that they become not underrepresented in these leadership roles, but that they're represented because they bring just a variety of perspectives that have historically been excluded from these executive decisions. I think that's a step that people can take. And then even within our own organizations, we need to be mentoring. So we need to talk to folks about where they see themselves, you know, even as they're moving into the next third of their career. Where do you see yourself going? Do you want to move up? What would help you do that? Do you need to go back to school? Is there a training program you can do? And so I think active mentorship in organizations would make a really big difference.
Active succession planning too. Yeah.
Absolutely.
Yeah.
Absolutely.
Right. And maybe even educating, you know, if we're just talking about physicians, educating our medical students and residents about the possibilities. Because you know, what I'm finding from meeting people like you through LinkedIn and social media, physician leaders, I would say majority of the people, and not you, but majority of the people I speak to say that they kind of found leadership through luck. And it shouldn't be through luck. It should be, you know, that we give them the opportunities and give them the confidence, you know.
Absolutely. I mean, I think people find things from Googling, which is great. And I'm glad that people have that resource. But we really should be telling somebody, like, if you see a young person who's a leader, you should be saying, oh, I did this amazing leadership program. You should consider it. I'll give you a prime example. I got an email a couple of weeks ago where they wanted me to testify in a hearing in Pennsylvania. So I emailed back to say, hey, I'm sorry, I've moved to Texas now, so I'm probably not the best person to testify. But here's a list of 5 other people who are women of color in medicine in the Philadelphia area, who I think would be an excellent panel or expert witness on this hearing for the Pennsylvania the General Assembly. And to give them that opportunity. And so this woman was like, I just don't know if I'm the person or if I'm ready. Like, you just have to believe in yourself. And I put your name out there, so you've got to do this. And I think giving her that vote of confidence and putting her name out there makes a big difference, because it's sometimes difficult to insert yourself. So we need to be reaching up and we need to be reaching back.
So good. Thank you so much. So how did you, okay, maybe we're going to end this soon, because I'm sorry, we could just keep going, because I always enjoy these conversations with people of very diverse backgrounds, and you're so unique. How do you overcome your own doubts and fears when you're advancing in your career? Like, how did you learn such confidence?
No, I think my confidence came from my mom. I think that she always had confidence in me and told me that, you know, I was a smart, confident Black woman, that nobody could take any of those things away from me. She also had these little adages, like she would say, beauty fades, smart stays. When you hear about people, you know, talk to little girls and say, oh, she's so pretty, she's so pretty, she's so pretty. And my mom never put any stock in that at all. And so, you know, I think while presentation is definitely important, you've got to present yourself professionally. I think really focusing on education and on educational achievement for me is something that has kept me going. So whether I'm learning about COVID-19 or thinking about the next step, I mean, even now I'm like, wow, I really like this business of medicine. Do I need an MBA? Is that something that I would need to do to take me to the next level? And so I think always having a commitment to learning helps you overcome. And then having a sounding board and having a tribe or a village around you where you can ask questions about, this is something that happened at work today. I'm trying to think about how to address it. That's really helpful as well. and not necessarily responding right in the moment. If you get an email that you don't like, or someone says something that you don't like, always sleep on it. So I think that gives you the chance to bounce it off a couple of people, think through, and how do you make sure that your response is something that will educate the person on the other side of that, and that will also, if it need be, to salvage that relationship, which is really important in the professional setting.
So you know what, also I really loved what you said before to me, Loren, is that you have this creative side to you that we all, like, we can learn to be creative, and everyone has a creative side that even if, I see so many people denying their creativity. And I used to do that all the time because my sisters are very artistic, but creative can mean so many other things. You are very creative in the way that you're thinking about the roles that you could possibly have. And even if it's not out there, you're thinking, I wonder if. Tell us a little bit about that.
Sure. I think doing those searches where I was just like, wow, we've been taught as physicians to think about health and medicine in traditional ways. And so I like to think, okay, outside the box. What would it mean to be a health officer so one of the things we have a lot of chicken manufacturing or chicken processing plants here. What would it mean to be a chief health officer at a manufacturing plant? So how do you ensure the health of your employees in that setting? We know that these are settings where people are adversely affected by COVID-19. How do we keep people safe? How do we meet them where they are, provide them with the resources? How does an industry that traditionally hasn't been in the health sector, so like an airline or an automobile, maker, how do they think about health, and what value could I lend to those spheres to help them think about the health of their employees so that they can deliver an amazing product like they always have, but also ensure that their employees have like this healthy and wholesome work experience, which is something I think we all need because we all spend so much time at work.
So good. And you take care of your employees, guess what? They take care of your patients.
That is a really
and then your organization thrives. So I love that. Thank you so much, Loren. If people want to reach out to you because you're so inspiring, who can they reach out to you?
Sure. People can email me. My email address is robinson.loren, and my Loren is LOREN at gmail.com. I welcome emails from anywhere. I'd love to hear from people. We've been in Texarkana a little less than a year, so we don't have a lot of folks close to us here on the ground. And so I'd love to hear from people and hear about your leadership journeys, or if there's anything I can do to help or mentor. That's what I love to do. So I would love that.
Thank you. And we're thinking about the state of Texas these days with COVID kind of increasing over there. So
yeah, it's going to be busy here for me for a little bit.
Yeah, stay safe. And thank you everybody for watching. This is Dr. Ko again from Lead Physician. We'll be launching our online course for physician leadership this summer. So reach out to me if you have any information, or if you want to hear some information. Also, if you want to talk, if you have a subject matter that we haven't covered, I would love to hear from you. If you have any feedback, I would love to hear it. So thank you so much. Thank you, Loren.
Thanks,
take care. Okay, bye.